Well, a very good morning. The Nehawu members might have been interdicted from preventing healthcare workers and also patients from getting the medication inside the hospital. But one thing that they are saying, they're going to continue their strike. They are demanding a 10% increase in terms of their salary, more amount allocated to housing allowance, and better health resources within hospitals. And they are saying they're not going to stop protesting because the cost of living is going high, inflation has gone up, and as things go up, their salaries remain the same. Joining this morning, who's also part of the strike now, is NOPSA, and her name is Nomonde Fanele, who is the chairperson of that organization here at Gqeberha Metro. Good morning, ma'am. Yesterday we heard that there was a court interdict preventing yourselves and also Nehawu from preventing patients and healthcare workers from accessing the facility here at Dorangenza. But you have said this morning that even despite the interdict, you're going to continue with your protest.
Sasazi, we are here as NOPSO. Remember when the NOPSO was not in those interdicts, because we were waiting for our national to declare for us where we are as NOPSO. Remember, we are in the same, because all the workers are fighting for the same. But as we know that when you join the strike, there are other things supposed to be done. We were waiting for our principals, but now the principals of us last night declared that we can join the strike as NOPSO. That's why we are here today as a chairperson of the region of the NOPSO to declare to our members that the strike of NOPSO, we are joining the strike as a NOPSO. Because we are fighting for the same. Remember, we have fighting since 2018 about the increment of public sector. But we realize that the government is failing us because it's us. Remember, there was the COVID. Now, we were there in the COVID, but the government didn't take us serious that we are in the pandemic. Now we are not supposed to strike. We're here today to say we will fight until we get what we want as a public sector, as a NOPSO.
Mrs. Fanele, there's been mixed reactions about the strike. Some saying they understand the plight of the workers, especially the healthcare workers, who you say for a long time have been marginalized financially. But others have been saying, was there a need to prevent patients who use this facility for healthcare purposes from coming in?
Remember, ma'am, we are so worried about this, what is happening now, because our superiors sit in the tables with the government, talking with the government, because we know that we signed our things as a nurses. We signed everything that is our patient is the first priority. But we see that the government didn't want to listen. Remember, there is the money they gave us to say, can we wait? We will give you your money. We signed on 2018 for 3 years. We didn't get any cent. They gave us 1.2. Next month, that's 1.2 is going to be taken because they say they don't have money. But they are sitting there. It's us are working. We are because this is our community that we are serving. But the government likes us to fight between us and our community. We are not happy what we are doing because the patients are having the rights. But in us as workers, we having a right to work in a safe place, to work in with the decent wage. We want our wages to be increased.
And Mrs. Fanele, another issue that also came up during the time of COVID were the improper health working resources within hospitals. I know, for instance, the maternity ward here at Dorangenza has been one that has really been a sore eye with patients lying on the floor while they're still pregnant. The casual unit also quite a disaster. Are those some of the factors you guys are also protesting for, to say, can we also get better working conditions as workers, especially in government hospitals, which are in such dire need in the communities?
It is so stressing, Sasaj, because, you know, in that time, more of the health workers died. Even the government and the department didn't show anything about that. Till to date, the children don't have the parents because of the pandemic of the COVID. We are sitting here doing, the government didn't take us serious. But when there's the thing, we are first thing to say the healthcare workers not supposed to do anything. We want the government to listen to us. We want our government to listen to us as we say, we want our money. We want our increment, everything we want. So if the government didn't want to talk with us, who will talk with?
The last, Ms. Faleni, are you saying today by being here that joining hands with Nehawu, you're going to carry on, intensify the protest so until your demands are met?
Yes. Since we start today as NOPSO, we will sit here and fight for our rights until the government talk to our superior to say, let's go back to work, we will give them their money. Till to date, we will come and sit waiting for our superior to say what's going on in the remember last month there was this thing of PSBC with PSB to say let's go and talk, let's go to the table, but it is not serious to our government. We must fight before they took as serious that we are serious. We are worried about our community because those are our mothers, they need to have a treatment. Those are our children, they need to have a treatment. But you see our government is failing us dismal. Thank you.
Well, that was Nomonde Fanele, who is the chairperson in NOPSO, saying that they're going to intensify the protest. They will not stop until their demands are met. They are demanding a 10% increase in their salaries. They're also asking for better working resource in hospitals and also saying more money in terms of their housing allowance, saying that they do understand the plight of residents, they do need medication. Those are their mothers, their sisters who are suffering because of this protest. Also saying that because things are going up, they cannot afford to stop their protest. For now, let's go back to the studio.